What is the sympathetic nervous system? It's our fight or flight response. It's also responsible for maintaining bowel and bladder function, heart rate regulation, and it even causes anxiety if it's elevated. Now, the sympathetic nervous system gives sensation to all of the internal organs and the discs in your neck and back, and anytime there's any disruption of these structures, it will be sensed in the sympathetic nervous system. This can trigger a reflex where you have other changes in your sympathetic nervous system. So pain in the gut, pain in the pelvis, pain in the discs may trigger anxiety. It may increase your heart rate. It may cause a fight or flight response. Identifying this response clues us in as to where this pain may be coming from. It's also an avenue for treatment. When we're treating these underlying structures, often the sympathetic nervous system will regulate itself, but sometimes it's taken on a life of its own. Sometimes it becomes a spin-off series that we have to treat separately. So we will identify the primary source of pain, treat that, and then separately re-regulate the autonomic nervous system. Sometimes when the sympathetic nervous system is out of control, it's like a fire. And the flames are so large in this fire, we can't actually see what's burning. We can't see what those underlying structures are. So we will do either procedures to block the sympathetic nervous system or infusions of medication or different oral medications to try and get the flames under control. Getting the flames under control, dampening down that sympathetic nervous system response will help us see what's actually underlying and what's causing the pain, which will then allow us to treat it and treat the underlying issue. Now, when we do that, often the sympathetic nervous system will re-regulate. Sometimes it doesn't, sometimes we have to treat it separately, but at least we've identified the underlying structure and we have a path towards treatment.